Dr. AMAL Nuruddin. I'm a clinical associate professor at Texas A&M College of Dentistry and currently the interim department head of public health sciences. Let me start by recitation of Surah Al-Alaq. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم اقرأ باسم ربك الذي خلق خلق الإنسان من علق اقرأ وربك الأكرم الذي علم بالقلم علم الإنسان ما لم يعلم. Read with the name of your Lord, who created everything. He created man from a clot of blood. Read, and your Lord is the most gracious. He imparted knowledge by means of pen. He taught man what he did not know. Sadaq Allah al-Azim. I would like to welcome all of you in attending another Zoom meeting and a presentation. I would like to introduce the American Muslim Women Physician Association organization. It's a nonprofit organization founded in 2008, and it's a group of female Muslim physicians, dentists, and allied health. Our vision, which is the next slide, please, Dr. Indira, we have been very active during the pandemic, educating community and providing masks for the Metroplex. We have also provided meals for the frontline workers and merit awards to Muslim female students in medicine. AMWPA has a YouTube channel, and we would love if all the attendees can visit this channel. We had very useful and plenty of useful presentations recorded. And of course, our website is www.amwpa.org. Please visit the website and get yourself familiar with the organization. We are also soliciting donations for the holy month of Ramadan. Today, our presenter and our very precious board member is Dr. Indira JUSIC. Born and raised in Bosnia, Herzegovina, I'm sorry if I pronounce it wrong, it's a little bit hard, due to war there in 1990, she moved to USA in 1996 as a refugee. Got her Bachelor's of Science in Biology from the University of Texas at Arlington in 2001, completed Doctor of Dental Surgery from the University of Texas Health Science Center in San Antonio in 2005. She's a married dentist, a mother of one, enjoys traveling and meeting people and volunteering as well. If you have any question, please write them in the chat box during the presentation, and we will address all of them at the end of the presentation. Without further ado, Dr. JUSIC.
Thank you, Dr. Amal. Thank you for helping me with this, and I appreciate all your support always. I've been a member of this organization since 2008. We are doing lots of good work for community, promoting health, but also the blessing is that I met lots of people, lots of healthcare providers, and I've been blessed to get to know them and work together with them. So today we're going to talk about gum disease or periodontal disease. I just wanted to thank everybody that came today to this Zoom. It's a very busy day for Muslims. We are in month of Ramadan, and for our friends Christians, today is the Easter. So Ramadan Mubarak and happy Easter to everybody. So I'm just going to go to screen share if you can give me a second so we can get started. Are you guys able to see this?
Yes, we are.
Yes.
Okay, thank you. I just wanted to talk today about one important topic that's most commonly known about as a gum disease. This presentation today, we already had available on our website, AMWPA.org for a few years now. Dr. Amina Jamaluddin, she helped me make this for patient education a while back. So I just wanted to give her credit in this too. To understand this topic better today that we're going to cover, I just have to quickly talk about some words that we're going to use here. So for everybody to understand better, this is a tooth anatomy. What we see as a tooth in our mouth is actually just this white part that's above the pink. And that's called crown of the tooth. When we smile, that's what we see in our mouth. Crown of the tooth is covered with material that's called enamel. Enamel is the hardest material in our body. It's even harder than your bones, and it protects your tooth. It also enables us to chew. We chew soft stuff, but we chew also lots of hard stuff. So to be able to chew, tooth has to be strong. Also, under enamel, we have a material called dentin. That's the yellow part on this picture that has the black lines in there. Dentin is about the hardest or bones. It's covered by dentin, but also we have the parts that are under the gum, which are called roots, and those are not covered by enamel. The roots, which are they're covered by cementum. The white lines around the root represent cementum. Cementum is the more sensitive and thinner layer that's only covering roots. It's not meant to be exposed to air or to be exposed to the food. Also, inside of the tooth, we have a pulp chamber. That's the part that we know as a nerve, but it's not only hosting a nerve, it's hosting also blood vessels, because tooth, and doesn't matter how hard it is, tooth is tooth is alive. So the blood vessels, they bring nutrients to the tooth and they take them out. So when later on we're going to talk what happens when the cavity gets to the nerve, but most patients know that when that happens, it does hurt, and then we end up needing a root canal. But it's actually what hurts in that situation. It's not just the cavity got to the nerve, but all the cells come through these capillaries to the tooth to fight the bacteria that got in there. So lots of swelling happens, and we have lots of pain and pressure. Our tooth is held by the bone. Bone is like soil or foundation that holds tooth firm. The bone is called alveolar bone. Also, we have the ligaments, which I try to explain to my patients. You can imagine them as the threads that are holding and making connection in between your tooth and your gum and your bone. So that's holding the tooth firm in there. There are also a couple different types of teeth. There are your incisors, your canines, which are your front teeth. They usually only have one root. Also, there are premolars and molars in the back. Incisors are made for cutting food. Molars are made for chewing. The molars usually have 2 or 3 roots. And when we later on, we're going to talk about periodontal disease, but because front teeth, incisors, they only have one root, they're most likely to be affected in the beginning by periodontal disease because they lose bone quickly. And because they have only one root holding on, they tend to become loose. Also, I just wanted to mention dental caries or tooth cavity. That's one of most spread diseases of humanity. They say that because of tooth decay, the kids miss the most school. So there's different types of cavities. We're not going to go too much into detail today into cavities, but if the food sits on the top of the tooth, on that enamel that we just talked about, that's the white part that we see here in the picture, then over the time, we will get a cavity which we call pit and fissure. Each crown of the tooth, as I mentioned earlier, crown is the part that we see in our mouth when we smile. It has little valleys and little mountains. So the food is more likely to sit in those little valleys. And just if it's not brushed off and it sits long time, the bacteria that lives in the mouth, or the bugs that live in the mouth, they come and they eat on that food, they produce acid, and you start getting cavities. Also, we have smooth surface caries, which is, I'm sorry, you guys able to hear me? Which is smooth caries, smooth surface caries is on the in between teeth, which we call interproximal caries too. That's pretty common that people that don't floss get it. Also, I tell my patients if they consume large amount of sweet drinks, they're more likely to get it. And we, lots of patients know that Cokes are not good, but also we recommend patients not to all drink juice all day. Sports drinks are very acidic too. And even if we think like juice is good for us, and I'm sure there's stuff in juice that's good for us, drinking it all day can give us these kind of cavities. Also, there is in this picture represented, it's a root caries or a root cavity. That's the cavity that's on our roots. And as I mentioned earlier, the roots are not covered with this hard material, which is called enamel. They don't have that hard protection. So once it gets to the root cavity spreads really, really quickly. And, usually what I see, where I see a root cavity in our patients is in patients that already have advanced stages of, they have lots of cavities or they have some health issues, and due to consumption of medicines or past history of radiation, they have dry mouth. So people that have dry mouth, they're more prone to the cavities because our spit or saliva is so important in cleansing our teeth. There is also another form of caries, which is early childhood caries, and that happens in little kids. I'll switch to another picture so you can see. When we give our kids a bottle at night and they sleep with milk all night long or juices, they consume it all night constantly, and this spit becomes sugary, so they can, it does not get to cleanse their teeth. Their teeth are never getting a break, basically. So in that situation, these kids are starting to develop, and if teeth are not brushed, of course, they're getting these white spots. The white spots happen when the food sits on your teeth and environment in your mouth is such that the teeth cannot recover. It's always acidic, it's always sugary in there. So the white spots are happening because tooth becomes weaker and then it gets a little harder again. That enamel, it remineralizes and mineralizes back. So they don't keep the same color. Color is changing. So when we see these white spots on our kids' teeth, on baby teeth, we know that there is a problem, that oral hygiene needs to get better, that this kid should not get too much juice, that this kid cannot have bottled to bed. you know, because this disease can get pretty bad. And these are little ones, so they're not going to sit in a chair once they have this kind of cavities and they need excessive work and they need crowns. These kids are going to have to be sedated and placed in OR. And we, you know, every time we have to put our little ones under anesthesia, it puts them under lots of risk. So taking that bottle away, or you know, making sure we're brushing, cutting the juice, it's going to do them a lot of good. So this is another slide that talks about tooth decay, how it works. It shows pictures from a healthy tooth to decay in enamel, to advanced tooth decay, to decay in dentin, and then into the pulp. Actually, when I graduated from San Antonio during my training, you know, we were taught that decay in enamel, if it just incipient caries, what we call, that's a very small decay, can be remineralized if we properly clean our teeth, if we consume right foods and keep our mouth healthy. But once the cavity gets into dentin, that's when you need to get a filling. But if you wait too long, then the cavity goes into the pulp. Then we need extensive work, needing a root canal, needing a crown. And, you know, that's why prevention is important. That's why food choices and oral hygiene, we need to look into getting that better. So once the cavity reaches into the tooth becomes infected, it needs a treatment, it needs a root canal, or what we call endodontic treatment. So what happens during root canal? I just have a couple pictures here. When the cavity gets into the pulp is inflamed. Lots of times you won't be able to get the treatment that day because you're hurting, everything is inflamed, you cannot get numb. So lots of times they put patients on antibiotics, let them come back in a week or so. Inside of tooth, when we do root canal is cleaned, we clean the cavity first, then we go into the nerve chamber where blood vessels like little capillaries and nerve is, or remnants of it. And then we clean in there, we rinse really well, we fill it with this material called gutta percha, and we build the tooth back. We want to build the tooth the way it was before. And then whenever you have a root canal on posterior teeth, it's very important to put a crown on because this tooth that had a root canal, I like to compare it to dry tree. I tell my patients, your tooth is dry, it's not alive anymore. And lots of patients don't have a good sense when they bite on it because there is no nerve anymore for them to feel. They bite a little harder and the tooth breaks. That's why we're putting crown on there. So now we come to the topic, today's topic, which is gum disease. I just want to make sure that everybody understands there's two different gum diseases here that we're going to talk about. One is called gingivitis, one is called periodontitis. So when the patient comes to me and tells me, you know, I have a little bleeding, that's a good sign that they have some form of gum disease. When they're flossing or when they're brushing, if their gums bleed. So then they're gonna come and we're gonna check them out. You know, we're gonna do x-rays. And then what we're gonna do is we're gonna use a small probe and we're gonna check their gums. We're gonna check for pockets, we're gonna check for bleeding, we're gonna check for tartar, which is hard sediment that forms around your teeth. So, and then we're gonna determine which gum disease they have. So in this case, the gingivitis is a milder form of gum disease. It can cause irritation and redness, and usually patients have a little swelling. Well, that shows that they have inflammation of gingiva. So gingiva is the pink part that we see under the tooth. That when we open our mouth, as I said, we see the crown, but we see the pink, the gum, which is gingiva. And then basically what happens in this situation, if patient does not have a proper oral hygiene, they leave little food on their teeth. They're not flossing, they're brushing, but they're not maybe brushing right next to their gums, and they're not angling that brush properly. So they're leaving plaque on there. So the plaque is food and bacteria in there, bacteria eating this food. So your gums, also, if the plaque sits here on your teeth for a long time because everything is wet in your mouth, that's going to form a sediment, what we call tartar or calculus. Sediment is hard stone. Usually patients would tell me, doctor, I have something black on my teeth, like something down on the bottom. Usually they can see their lower teeth, lower front teeth. That's that tartar we are talking about. So your body sends a response, because this tartar and this plaque is a foreign body. This is almost like a splinter in your finger. And all the blood cells, they rush there. So that's why we have infection forming there, because the body is fighting this. And then that's why we have bleeding, because lots of blood cells, they just rushed in that area. We just want to make sure that everybody understands that the most common cause of gingivitis is poor oral hygiene. It can be prevented. Also, if the patient comes to me and we determine they have gingivitis, doctor, I have a little bleeding, they have a little tartar, they have plaque on their teeth. If we work hard, if we teach them how to, they need to brush, they need to floss, they follow instructions, we do cleaning, and then we do cleaning if needed in 3 months or 6 months, to put them to shape. This can be reversed, and they're good. If they do what they need to supposed to do, this doesn't go anywhere else. Their gums become healthy, and then they continue brushing twice a day, flossing, seeing doctor every 6 months, and this is not a problem. Well, periodontitis is a more advanced form of gum disease. This is a chronic infection. It's affecting gums and bones around the teeth. That alveolar bone that was holding the tooth, that gets affected too. When gingivitis is not treated, it can advance to periodontitis. And then that means inflammation around the tooth. Gums pull away from teeth, form spaces. Spaces are called pockets. And then a body immune system fights bacteria as the plaque spreads and grows below the gum line. That becomes a big problem, because bacteria kind of goes inside all the way in those pockets. And then bacterial toxins, and it's actually the stuff the bacteria produces in those pockets. And the body responds to bacteria, and that even food gets in there, and forms tartar. The body has this natural response. And it's infection starts. What I tell my patients, because they say, oh, I don't hurt. I tell them this is low-grade infection. So this is silent infection. And lots of times when they come to me, if they have these pockets and they lost this alveolar bone, I tell them, this is not something that happened within last 20 days. You've been having this for years. Maybe you had this for 20 years. It's just that this kind of infection does not hurt. It's a silent killer of your teeth. Basically, infection is breaking down bone, it's breaking connective tissue that holds teeth in place. And if you guys remember that first slide, connective tissue is also those little ligaments, that thread that I told you. Imagine those are little threads going from tooth to your gum, or from tooth to the bone. They're holding tooth in place. And then if that's the tooth support, so if they're destroyed, tooth becomes loose. The thing is that lots of patients, they lose their teeth due to periodontitis, and most teeth never had a cavity. So they're the perfectly healthy teeth, but the gums around teeth are not healthy. So the causes and symptoms of periodontitis are poor oral hygiene, smoking, systemic issues, immunocompromised diseases, medications that cause xerostomia. Xerostomia is a fancy word for dry mouth. we just mentioned a little bit in the caries section about dry mouth. Also, if you have crowded teeth or they're misaligned, because of their position, you cannot clean really good right there. And there is like, that can be one area that you're forming periodontal disease, because it doesn't have to be all around your teeth. It can be only that area of your teeth are crowded. Also with hormonal changes, you can get some gum disease. Like for example, pregnant women, they do tend to, because of change of hormones, tend to have a gingivitis. The little plaque, if they leave on their teeth, it can cause them bleeding when they're pregnant, and they did not have any bleeding when they were not pregnant. Also, diabetes is a big cause, and we're going to talk about it a little bit more, but diabetes is a big cause of periodontal disease, and it has a big connection to the periodontal disease. Where patients that have diabetes, they have enlarged and inflamed gingiva more than other patients. They have deep pockets, they have rapid bone loss because of periodontal disease if they don't control their sugar well. Also, I read somewhere that because if patients don't control their sugar, their mouth is more sugary. So the bacteria, they thrive in there, they're happy. Hey, they're getting all this sugar. So that's why they're more prone to periodontal disease. And also we have to remember that there is also type 1 diabetes. So we have kids, they're diabetic, and the kids, they're 13 to 18, they have type 1 diabetes. Among them, there is about 9.8% of periodontal disease. And in kids and in people that are 90 years or older that have type 1 diabetes, there is 39% of periodontal disease present. So that's the periodontal disease is the sixth most complication of diabetes. Now I'm going to talk about symptoms of how patients can, kind of know, and how we know that the patient has a periodontal disease. Patient can have bad breath. The gums are usually inflamed. They're tender. They're bleeding. A lot of times, even in gingivitis, that's the first sign of gum disease is bleeding. When periodontal disease gets more advanced, teeth become loose. So patients are gonna have pain on chewing. And on some days, the teeth are gonna be more loose, and then they will get a little bit more firmer, then it will get loose again. So eventually, they will lose all bone support and become very loose and fell out on their own. Also, one thing that's pretty common with patients having gum or periodontal disease is it's receding gums and longer teeth. Patients would tell me, oh, doctor, my teeth just become longer. They were not this long. I have these areas where my gum is getting, lower. I don't like it. They usually notice it again on their lower front teeth most of the time. And, they point, oh, I have something black here. And, the gum kind of got down and my tooth is longer. I don't like it. That's the, one of the symptoms of periodontal disease. So here we have different stages where we go from healthy gums to advanced periodontitis on 4 pictures. So as you can see on the first picture that, gingiva, which is the tissue, the pink stuff around your teeth, is pretty pale, that it's healthy, that there are no stains on the teeth, that there is no gaps in between the teeth. So that's the healthy. And then we go into gingivitis. On the second picture, we're going to see on the lower teeth, there is little red borders and some yellowish film on the bottom teeth. So the gingivitis is starting right there. And Bacteria is there in that plaque. It's irritating gums. It's making them a little red, a little puffy. As you can see, two central lower teeth present that the best. And then they're going to bleed, maybe if we touch or if the patient brushes. If the plaque is not removed, the plaque is going to become hard. It's going to form tartar. So we go to the next picture, which is the third picture, and you can see a little brownish on those two lower teeth. And that's the tartar, and that stings. And at this point, patient cannot remove that anymore with their toothbrush. So that's why it's important to come to dental cleanings where we have special instruments, and our hygienists would use those special instruments. They spray lots of water and they vibrate really fast. And she would break this tartar. It will, gums would get better after that. So also on the all the way to the right, we can see what happens when we have advanced stage. When your disease progresses, periodontal disease. So basically we have gingivitis, and then we have three stages of periodontal disease, which is mild, moderate, severe. And then once we get to the severe, your teeth are already getting loose. Your gums pulled away pretty well from your teeth. Lots of patients have lots of buildup. The teeth, if you press on the gum, sometimes you can have a little pus coming around your tooth, right next to where gum joins to your tooth. So that's why in this picture, little pus is presented, and marked as yellow in here. So how do we treat this? So when the patient comes for an exam, they're going to, as I said, have x-rays done. And then how we assess, we're going to assess your bone right here, because on x-ray we can see your bone. But we also want to, of course, look in your mouth, and we want to assess if you have a plaque. We want to look, do you have plaque? How much plaque you have? Do you have tartar? That's that hard sediment that formed from plaque that was not removed for a long time. Then also we're going to take a little instrument, very skinny instrument, where we're gently going to measure pockets in your teeth, around your teeth, in your gum. And that's how we're going to decide what stage of disease you're in. So every tooth, we're going to check, we're going to walk that probe in 6 spots around the tooth. And this is very gently, this doesn't hurt. But it's very important to know, it's going to assess that periodontal or gum health of every single tooth. So when we check all your pockets, then we're going to know. And with that probe, we're going to measure in millimeters. If it's up to 3 millimeters, you're still in good shape. You might have some gingivitis, but you don't have attachment loss. But if it goes above 3 millimeters, then, like 3 to 6, usually in moderate phase of periodontal disease. But if it goes above 6, you're in severe phase of this disease. So how are we going to treat this? Treating of periodontal disease consists of what we call scaling and root planning. Scaling, we have special instruments because you have these pockets. We're going to go very gently. We're going to get you numb. And there's 2 options. The doctor might come in and get you numb, or we have some drops that can be placed in pockets, again, very gently, and get the teeth numb. And then we go very gently with these instruments, and we first clean this plaque, this tartar, this bacteria. Also, we have these instruments called cavitrons, they spray water, they vibrate, so you're going to get a rinsing effect from these pockets. And also, after we are done with cleaning stuff, we're going to make sure your roots are smooth. Why smooth? Why do we want to smooth them? So that's what we call root planning. We want to smooth them so this bacteria doesn't sit on your teeth, like doesn't find little holes to hide. So it's harder for you to clean. So if if it's smooth, bacteria, food is not gonna get stuck on it. It's less likely to stick on your tooth. So it is going to be done either by dentist or hygienist. And also, once this is done, your gums are going to get healthier. You're going to see less swelling, less puffiness. And then also in advanced stages of periodontitis, you might be referred to a doctor called periodontist. Periodontist is doctor that treats periodontal disease or gum health. It's doctor basically for bone and tissues around your teeth. So what they can do is they can do surgical scaling and root planning, where they're going to get you numb, remove those gums, clean, because if you have pockets of, let's say, 7 millimeters, it's really hard for us to get in there with our instruments, with our hand instruments. So they want to remove your gums, flap your gums just a little bit, and then clean in there, maybe put some medicine, maybe you'll have some options into putting some bone in there, which would be bone grafting, just a bone powder for the bone to recover. Or also if you lost your gingiva, if your gum receded down too far, there is an option of getting gingival grafting. So they will take maybe a piece of the tissue from your palate, and they will put it right there. So you will not have this spot where your front teeth are not looking very good. So it is very important that you maintain your oral hygiene, because if the patient comes to me and they have periodontal disease, first thing I ask them if they floss, because most of our patients nowadays, they do brush, and yeah, we need to brush twice a day. Most of them, they say they do brush twice a day, but sometimes we overlook flossing. We don't think, hey, that we just cleaned just part of our tooth, and these surfaces there in between, we did not clean them. So just flossing is very important. Seeing dentist is very important. And you're going to have what we call scaling and root planning is more often called in a common language deep cleaning. So after you're done with those deep cleaning, you might have 1 or 2 visits at the doctor's office to complete this deep cleaning. Don't think you're done. You're going to have to go every 3 months. And when I tell my patients about this periodontal disease, once you're diagnosed with it, you're stuck with it for the rest of your life. So if you have periodontal disease, it's almost like diabetes. You have to take care of it every single day, and you never grow back the bone that you lost. So we can only stop this with scaling root planning. We cannot grow the bone back. So if you came and your this periodontal disease is mild and moderate, you're probably in good shape. We're going to do scaling root planning. We're going to make sure you're doing work at home, flossing and brushing every day, coming every 3 months for cleaning. Because if you have this disease, you're probably more likely to build that tartar that agitates your gums, and then your periodontal disease progress. If you come every 3 months, we're going to clean that tartar in our office, and you're going to maintain your teeth. But you have to maintain it every 3 months. Very important for the rest of your life. So there is one important thing also that I want to talk about. When patient comes to me and they have a periodontal disease, as I said, I ask them if they floss, and the second thing we ask is if they smoke. So we probably all know what are the difference in between smokers and smoke-free mouth. And, as we can see here on one side, we have smoke-free mouth, teeth are not stained, patient has pale gums, they have their oral teeth, they're white, they're healthy, they have fresh breath, they have younger looking skin, they have, things are going good. And then on the right, we have smoker's mouth. they have stains, they have gum disease, they're more prone to cancer. The oral cancer, they're more prone to leukoplakia, which is white patches in your mouth, inside of your mouth, that can be precancers. So they have scaled tongue. So, there is lots of talk about smoking and how smoking is damaging to your health, but it's very damaging to your teeth and to your gums and bones around your teeth. So, for example, smokers are 12 to 14 times more likely to have severe loss in periodontal disease. They lose more teeth than non-smokers. They're 2 to 6 times more likely to show periodontal destruction in their mouth. They're 18 times more likely to be infected with periodontal pathogens, to have this periodontal, basically the bugs, the bacteria that destroys your gums and your bones around your teeth. So they say that 42% of periodontal cases are attributed to smoking. 11% of patients that have perio are former smokers, and 75% of perio in smokers is due to the smoking. So 75% of patients that are smokers that have periodontal disease is because they're smoking. And so there also, we talk to patients about options, how to quit smoking. This slide also shows a little bit more of effect of smoking: stained teeth, stained tongue, diminished smell and taste, delayed healing. So delayed healing is actually one of the reasons why periodontal disease is so common in smokers, is because their blood vessels, their capillaries in their mouth, they constrict. And the smoker does not have a sufficient, basically, blood supply to their mouth. And so they cannot heal because they have this constant infection in their gums if they're leaving some plaque and there's some stains. So they cannot heal properly. So the damage is more. Also, with smoking, you're less likely to heal well after you pull the tooth. You are more prone to oral cancer. You have cosmetic problems with your teeth and so on. So there's always a constant talk with every patient that comes to dental office how to quit smoking. So I tell my patients that what we've seen is that most people don't quit on a first try. It's something that you might have to try a couple times, like 4, 5, 6 times before you're successful. So don't be discouraged if you try and then you come back to it, because eventually, if you keep trying, guess what? You're going to quit. So what can be used for, there's lots of products that we can use. Some of the products are covered by health insurance. Your doctor can prescribe them. We can prescribe to you if you are willing to quit. You can buy nicotine gum. There is also lots of nicotine products, like nicotine inhaler, nasal sprays. There are these tablets that you can suck on that release nicotine, and there are patches. Patches, you place them on your skin. Doctor can prescribe those. As I said, it's covered by insurance. You're going to put that patch on, and then we have 3 different levels. So we're usually going to give you step 1 that has certain amount of nicotine in it. And then next month, after you're done with that box, you're going to go and cut to a little lower. And then the 3rd month, you're going to cut lower. And then you're ready to stop. Also, a lot of patients told me that doing electronic cigarette can help them. I would not recommend they inhale anything. They switch to doing inhaling anything. But just what they told me, it helps them to hold something in their hand. So that could be an option. There are also prescriptions that can be prescribed. There are also like the medication. There is medication called Chantix that patients can take. It does have some side effects. I heard that some people, from some patients, that they have vivid dreams when they take this. But you know, to be honest, I heard from people that are quitting without Chantix that they have some vivid dreams where they're ready to quit because they're so used to smoking and having that nicotine. Also, Chantix, you know, had some effects on some patients having some hallucinations, and so it's just, I think it can be prescribed to selected patients, but you know, some people can try that. There's also some other medicines that can be prescribed, like antidepressant, that it's also nicotine antagonist that can help with quitting smoking, and that would have to be done by your doctor. So I just wanted to talk about, you know, the oral hygiene here because it's so important in maintaining your teeth and gum health. This is just a picture that covers brushing technique. What I would tell my patients that we have to brush 2 times a day for 2 minutes in the morning, at night. I tell my kids' patients that nighttime brushing is most important because you know, lots of people are skipping that one, and you know, the food or bacteria sits on your teeth all night long. You're not drinking water. You're just, you know, and the bugs, I tell the kids, the bugs are just having party in there. They're eating off the food that you left on there. So very important nowadays because we are brushing so much. With brushing also, we've been doing some damage to certain areas in our mouth, you know. So I would recommend the softest brush that you can find. That would recommend fluoridated toothpaste, pea size, not more. Making sure you're angling your brush 45 degrees. And then also don't miss this area. Lots of patients are missing the area where the food sits right next to the gum. Because remember, that's important. That's what upsets your gum and causes you gingivitis and then periodontitis. Start brushing, make sure, remember, teeth have 3 surfaces: outside, inside, and chewing surface. So also you can use a tongue scraper, or you can use your toothbrush to brush your tongue. Also flossing, you know, is as important as brushing. You're brushing 2 times a day. You can floss only once a day. It's removing food in between your teeth, unable that, you know, your toothbrush is unable to reach. You will need to just keep in mind, you will need a piece of floss that's 18 to 20 inches in length. You're gonna wrap that floss around your fingers and you're gonna move it. You're not gonna floss with the same piece of floss. When you floss one area, then you're gonna wrap it a little bit more, move to another area of the floss, and floss in between 2 other teeth. So, just keep in mind that the plaque, which is bacterial film, that means that's a little food on your teeth, and then the bacteria overgrows grows again after you brush. So it forms back in 2 to 3 hours after brushing and flossing. And then keep in mind that in patients older or adults older than 35, more teeth are lost to periodontal disease than the cavities. And bacteria associated with periodontal disease travels into bloodstream, and it might you know, result in some other adverse health effects. You know, I know we talked more today about how it affects, how it's connected to diabetes, how it's connected to smoking, but the periodontal health or health of your gums and your bones around your teeth is connected to some other diseases too. So research has shown that gum disease can be linked to heart disease, because we think that the bacteria or the bugs that live in your mouth, they're causing your gum disease, you know, and how they go in those pockets where you had attachment loss. Those bugs, they, especially from your lower jaw, they flush directly into your heart when your blood circulates. So those bugs are going to travel in your heart. And also, periodontal disease is connected to the stroke. We've seen that the bacteria that causes periodontal disease have been found in some clogged arteries. Also, if you're diabetic, if you are diagnosed with diabetes, I also always recommend my colleagues, which are primary care physicians, they're treating patients with diabetes, to always ask them to go get a dental checkup. Because if you have diabetes, it's very likely that you have a periodontal disease, especially if you had diabetes with uncontrolled blood sugar for a little while. They somehow just go together. So if you've been recently diagnosed, go get your teeth checked. Also, very important with diabetes is that if you're working on controlling your sugar, but you have this periodontal disease, bugs or bacteria sitting on your teeth, you have food sitting on your teeth, you have tartar sitting in your teeth, your gums are inflamed, you have infection in your mouth. I know it's not maybe hurting you today, but you have a constant infection that's not helping you. Why it's not helping you? Because of that infection, you cannot control your blood sugar. So that's why it's important to get your dental exam once you're diagnosed with diabetes. Also, that periodontal disease has been connected to cancer, arthritis, preterm births. It's such a broad topic that, since we want to keep today our talk limited, I'm not going to go into too much detail, but for example, preterm births. We had some studies that said that the mothers that have periodontal disease, they're more likely to have babies that are low birth weight. So we had one lecture through this organization that's on our YouTube channel that talks about safety of going to dentist when you're pregnant. So they did say that, if the patient has periodontal disease and they're already pregnant, the cleaning might not be as effective in this situation as if like patient is planning to get pregnant. So if anybody's planning to get pregnant, I would recommend they go have a dental checkup too and get checked out for periodontal disease and get their teeth cleaned so they just can prevent any issues for their baby and chances of having baby with low birth weight. So, Dr. AMAL, she read the passage from Quran or a surah a little, at the beginning when we started a little earlier. And we have two slides that we have like a Islamic perspective on dentistry. The surah that she read was actually the first revelation of Quran. So there are 5 lines or 5 ayah in Quran that were revealed during Ramadan, and that's the first message to Muslims. And then now in the time of Ramadan, I just like to remember that. And then what was the first message? First message is read in the name of your Lord, who created man from a cloth. Read, and your Lord is most bountiful. He who taught the use of the pen taught man which he knew not. So I just wanted to, read this. Dr. AMAL already read the translation, but it's such a beautiful message. And the first basically message we got from God is we were told to read or to learn. So improve every day, learn, don't be blinded. There is so much knowledge, and that's why we as an organization want to educate our community and just, that's why during the COVID, we started this YouTube channel because, we couldn't get together with our community. We couldn't get together with our patients, but through these videos, we want to educate on different topics. And also one interesting fact that some of you might know or not know is that there is a stick called Misfuck that was used in time of Prophet Muhammad, and it's still used in Middle East, that has a very interesting antibacterial properties, and it was one of the first toothbrushes. So it says that the prayer, Salah, the Muslim prayer that was offered, that's offered after one has used Misfuck, that means after one has brushed their teeth, is 70 times superior to Salah, or a prayer that was offered without it. And also, the Prophet Muhammad said that if I had not found it in a hardship for my ummah, I would order them to make wudu for every salah and to use misfuck in every wudu. So to brush teeth actually 5 times a day, if it wasn't hard, if it wasn't strenuous. So there is just some picture how to misfuck is used. I was thinking this is very interesting. They have this I would call it almost like a piece of wood, and they trim it, and then they I guess chew a little bit on it, and then it exposes the little bristles. And then they soak it in the water, and it can be used to brush. And then it's recommended every 3 to 5 days to cut it and repeat to step 1. We recommend our patients. We have a lot of forms of toothbrushes now that we can buy at the store. I want my patients to use fluoridated toothpaste, but I just wanted to mention that there was something that was used for centuries, and the antibacterial properties that it has. And I was thinking this is very interesting. I just wanted to thank everybody today. I want to thank Dr. AMAL one more time. I'm really blessed that I know her, and that she gave me support today. I'm thankful to each one of you that helped me get this together. I'm very thankful to Tatir and Natasha that they put all this together. They're running the Zoom, and they scheduled the Zoom, and I appreciate all of you. I know it's been scheduled in some hard time where people are busy with other events, so I really appreciate everybody coming. So thank you very much, and I'm just gonna
Thank you, Dr. Indira, very much. If you can, please, yes, thank you.
Thank you, everybody.
Yeah, it's an excellent presentation, tons of information and very simplified. We appreciate the time you've taken to give us all of this huge feedback about periodontitis. And well, we are very sensitive to people's time, so I would give maybe, let's see, 3 minutes if we have any question. Although I believe Dr. Indira did fabulous job explaining everything really. Okay, let me check the chat one last time. Everyone is saying excellent and very informative and awesome and good job. It seems you left no questions for anyone to ask. Someone is asking, what are your thoughts on water pick?
Well, I think anything that can improve your oral hygiene, it can be great. So I think it's a great way. Some patients tell me that they would rather prefer water pick than flossing. Personally, I floss, and I like to floss, but whatever is going to improve your oral hygiene, I say go for it.
Another question, how often do you need to see a doctor if you have a periodontal problem?
Well, you're gonna still see a doctor every 6 months. Your exams are gonna go every 6 months, but you're gonna come more often for your dental cleaning or periodontal maintenance, as we call it. So most likely, if you have periodontal disease, you're gonna come every 3 months for your cleaning, but exam only twice a year. Because I think once they examine you, it's okay to go for 2 cleanings without getting a new exam.
Okay, another question, and I will say that's going to be our last question. Is the electric brush better than the regular toothbrush?
Well, what I think about it is that it what works for you. For some patients, electric brush can be better, like maybe for kids, because their dexterity is not as developed. But what I might not like about the electric brush is their heads might be a little too big. So I learned over time that sometimes it's harder for patients to put the brush all the way back if the head of the brush or the part of the brush that holds the bristles is too large. So they can find something, if they want to use electric brush, that's good. But I would find, even with the regular brush, I would find something, even especially if they have small mouth, that can fit all the way in the back. And so it's whatever works for the patient. Electric brush is good. Like if the patients are scrubbing too hard, they're just scrubbing back and forth. There's some patients, they think the key is being scrubbing hard, going back and forth. Maybe electric brush would be better for them, because most of electric brush, they spin right away. So they would get this circular motion instead of getting back and forth and damaging their teeth. So, if the people are doing good job with the regular brush, that's great. They prefer that. It's working well for them. It's okay to stay with that. But if they want to upgrade, or if they have, like if the patient had a stroke or had some other issues, arthritis in their hands, they cannot, they feel like they cannot go in there and do circular motions, then go with the electric brush.
And what is a good brand, Dr. Inder?
Honestly, you have a Sonicare, but I don't use it all the time. Because it vibrates a little bit. So I almost feel like it's a little bit more expensive though. So it vibrates. I feel almost like that vibration, and that cleans a little better. So like recently I done braces, and then when I felt, hey, I need just a little extra clean, I went ahead and charged my brush, and I did it with that brush. But that's what I use. But again, except for that, I cannot really recommend anything else. If they want to go with a cheaper one, that one is going to spin, just look for the smaller head, and that's okay. If they want to go with a little bit more pricier, I would say Sonicare.
Wonderful. How about mouthwash?
Well, mouthwash, I personally tell my patients, they think if they're rinsing with mouthwash, it's okay to rinse with mouthwash. I'm not a big fan of mouthwash, to be honest. The reason is because mouthwash has alcohol in it, and the alcohol burns your gums. And we had, when I was in dental school, we had this challenge when Listerine put out challenge. If you, I don't remember how long, if you rinse for this long, that this is gonna be good. And then we ended up having these ladies coming in with burned gums and mucosa, like tissues in their mouth, and we couldn't figure out why. And they were doing this Listerine challenge. So my recommendation is, if it has alcohol, I wouldn't use it, because alcohol burns your gums. And what we've seen in smokers and alcoholics, that are more prone to oral cancer. So I would try to find one that doesn't have alcohol.
Yeah.
There are some there that don't have alcohol that might stain your teeth a little bit. There are some mouth rinses, if you're more prone to cavities, they have fluoride in them, like ACT. I would recommend patients, if they have cavities, to go ahead and use that one. There is also something that I forgot to mention during the lecture, is that there is a prescribed mouthwash, which is called Paradex, that doctor, dentist would prescribe to their patients to use for periodontal disease because it kills bacteria in their mouth, and they would rinse with it twice a day. So if they have a periodontal disease, you know, in the beginning, right after they're diagnosed, that could be a good option. It does make you build a little bit more stains. So maybe before you're done with your cleanings, you know, maybe in that phase, you can start rinsing a little bit with it. And then if you really have advanced stage of periodontal disease, that's a good option. Thank you for asking that question.
Okay, I have here, can you remove plaque with tools at home?
Oh, that's a tough one. You can, but if you don't have proper training, you can do some damage. So
Which is plaque, I believe Dr. Indira can be removed at home, but not the calculus, right?
Yes. I mean, plaque is removed, plaque is soft, so with a toothbrush, but if they were asking tools, you know, somebody that didn't have training how to use those tools, if they're metal or, you know, plastic might not do as much damage, but if they're metal, you can damage a tooth. And if they're plastic, you can damage your gum. So, you know, if it was me, I would let dental professional use those tools on you and go every 6 months, which should be sufficient.
Okay. We have one more here. Okay. How do you prevent receding gums?
Okay. Well, that's a tough one. You know, over the years, gums do recede a little bit with age. That's one thing. Second thing is if we are brushing improperly, if we are not going in circles, if we are just scrubbing back and forth, that can damage our gums. Also, we can prevent gums from receding if we get regular dental cleanings and we don't get periodontal disease. I think receding gums, probably periodontal disease or gum disease is #1 cause of receding gums. So if we do oral hygiene, don't scrub too hard, don't press too hard on it. Also, if they get your dental cleanings, and also some people have habits of putting like a pen in their mouth. If they, you know, just scrub with their nail, that can just make one spot on one tooth just gum recede. So if you have any bad habits, don't pick on it. But the main cause is improper brushing and not getting dental cleanings. So brush gently and come for your dental cleanings.
Wonderful. Well, and I don't see there is a question about the whitening toothpastes and if they do really work or not.
Well, whitening toothpaste, I think they do some work. Just keep in mind that they can make your teeth sensitive, and they can, you know, if you didn't have problems with sensitivity, meaning when the cold water or ice cream hits your tooth and you don't have a problem, you're blessed. And then if you go whiten, you might develop some sensitivity. So another thing is that I would be careful is please have your dental checkup before you decide to whiten with anything, because I've seen patients, they decide to whiten, didn't have dental checkup. They had a cavity and they ended up needing a root canal because that whitening gel got into the tooth and it became a mess.
Okay, and how often do you need fluoride treatment?
We usually give it every 6 months, you know, during the dental cleaning. And You know, what I've seen that insurances, they usually pay for kids, they don't pay for adults. But if you have some cavities, please do it, you know, because that means you're prone to cavities. If you have cavities, you're prone to have some more cavities because of those bugs living in your mouth. And, you know, even if you have to pay and your insurance is not covering, please take that fluoride, you know, when you go for your cleaning.
Wonderful. I don't have any more questions here. And with that, I will say fabulous and wonderful job, Dr. Indira. And we were very fortunate to attend your presentation today and hear what you have to say about the periodontitis. Thank you very much. And thank you, everyone. Again, our website is www.amwpa.org. Thank you, and we appreciate your presence today. Salam alaikum.
Thank you, everybody. Thank you for giving your time. Salam alaikum. Thank you.